Okay, good afternoon, and thank you everyone for joining the daily briefing on the City of Philadelphia's response to COVID-19. Today, all the speakers are again joining this briefing virtually to adhere to social distancing guidelines. And we'll begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thank you, Mike. Good afternoon, everyone. I'd like to begin by reminding everyone that May is Mental Health Awareness Month. During this challenging time, it's more important than ever to seek help if you or your loved ones are struggling with anxiety, depression, grief, or another mental health condition. Last week, we announced a campaign that the city developed with Independence Blue Cross to make resources easily accessible to more Philadelphians. These resources are available at Mindful Together. That's MINDFULTOGETHER, mindfultogether.com. I also want to call attention to support specifically available for our children. Last week on National Children's Mental Health Awareness Day, the School District of Philadelphia announced a partnership with Uplift Center for Grieving Children to offer the Philly Hope Line. It's a new resource where district students and families can obtain mental health services. Dr. Haidt and the district recognize the mental and emotional toll this pandemic and the subsequent closing of schools may be having on our students, families, and caregivers. Students miss their friends and teachers. Seniors are disappointed about missing out on traditional events like prom and graduation. And caregivers are struggling with children learning at home, while many times also working from home themselves. Philly Hope Line, which officially launched 2 days ago, is staffed by clinicians employed by Uplift. It offers counseling services for students, parents, and guardians. It's available by calling 1-833-PHL HOPE, HOPE. That's 1-833-745-4673, or by texting the same number. The service will allow students and families to speak with clinicians by video and by phone. If students and families call outside the window of operation, they will have the option of leaving a message and will be provided with a crisis phone number in case of an emergency. All messages will be returned the next day. Clinicians will be available via Philly Hope Line Mondays through Fridays from 12 p.m. to 9 p.m. and holidays, Saturdays, and Sundays from 12 p.m. to 4 p.m. Once more, the number is 1-833-PHL-HOPE. I thank the district and Uplift Center for Grieving Children for supporting Philadelphia's youth and families in times of crisis. Today, I'd like to share some good news for a change. Philly Counts, the city's initiative to support the 2020 census, has reached a huge milestone in their outreach efforts. Each day, Philly Counts and its volunteers call thousands of households in Philadelphia to make sure that they have what they need to stay safe and healthy and create census awareness. Yesterday, Philly Counts surpassed 50,000 calls. They've made 52,375 calls and had 8,354 meaningful conversations with Philadelphia residents. During these conversations, Philly Counts and its volunteers help people make a plan to complete the 2020 census. This week, the team is also focused on sharing information about the COVID-19 Emergency Rental Assistance Program. Philly Counts is practicing trauma-informed engagement as they reach out to our residents about the census. After helping them address urgent needs, such as food access or how to find a testing site, they encourage census participation. A complete and accurate census helps the city of Philadelphia respond to emergencies, such as the COVID-19 pandemic. Census data is useful to identify census tracts with large at-risk populations where resources such as our food distribution points should be deployed. It is also used by the federal government to allocate funds necessary to rebuild our communities after a disaster. Today, more than ever, Philadelphia needs a complete and accurate census count. Remember, if you live in Philly, you count in Philly. Residents can complete the 2020 census over the phone by calling 844-330-2020. That's 844-330-2020. 888-2020 and online at my2020census.gov, my2020census.gov, and via paper questionnaire until October 31st, 2020. And now I will turn it over to Dr. Farley for his daily update.
Thank you, Mayor. We're continuing to see progress against the coronavirus. In Philadelphia, since this time yesterday, we've had 242 new cases of the infection confirmed, bringing us to a total of 18,779. The trend in the number of new cases is clearly in the downward direction. That's a good thing. We're also continuing to see progress in our outbreaks in congregate settings, such as nursing homes. Just a reminder, we have a graph that we're having on our website that we'll update every day, shows the number of cases by day in nursing homes. And you can clearly see that that's going in the downward direction. Likewise, in the city jail, we're making progress. We've had 0 new inmates tested positive since this time yesterday. There's 7 inmates in the facility right now that are currently testing positive. I do have some sad news to report today, unfortunately, on deaths. We have confirmed 78 new deaths from the coronavirus infection, bringing us to a total of 986. Well, let me explain why it is we got that large number in one day. That came mostly from our matching 2 different databases. We have a database of cases that are reported to us, people with a confirmed coronavirus test, and then we have death certificates, people who died. And so much of this appears to be people who were reported to us as positive before, and then later we found out that they died. We do that match of these databases about once a week, so there will be periodic times when we get more deaths than usual. This is the largest number reported in any single day. Most of those people appear to have died between the period of April 21st and May 7th. So not in the last couple of days, but in the last 3 weeks or so. So if you look at the graph overall, number of deaths per day, even with this new information, it still appears to me that the trend is downward. But the peak, the worst time of number of deaths per day, is a little bit later than the number of the peak for cases, which is what we would expect. Of those 986 total deaths, 528 to 54% were among nursing home residents. So still nursing home residents represent a large portion of the total deaths in the city. In our hospitals, we're continuing to make progress. There were 741 inpatients with this infection in Philadelphia hospitals this morning, and 1,421 in the Southeast Pennsylvania region. Those numbers are continuing to decrease. We're going down about 8 days in a row there. We have a new graph on our website that we're posting today, which is a graph on the number of hospital admissions for coronavirus. The other numbers I've been reporting every day are the number of patients who are in the hospital at any given point in time. This graph shows you how many patients are newly admitted to the hospital. And that graph is showing a peak around April 15th, and we're going down since then. So that's a good thing. It's another way for us to track the progress in the epidemic. Testing is available, as I've said before, anyone in the city, regardless of age, who has symptoms of coronavirus infection. There are more testing sites we're adding all the time. People should just go to their website, look at the different testing sites, see what's there, call ahead with the phone numbers that are there, make an appointment, and go in and get tested. Let me point out that as the case counts go down, there will be an increased importance of testing and increased importance of contact tracing. So we will continue to expand the availability of testing to the degree that we can. And we will be putting in place systems for contact tracing. What that means, what contact tracing is interviewing people who have the infection, find out who they might have been close to, so who they might have exposed the infection to, and then contacting those contacts, those people that they are nearby, and telling them that they need to go into quarantine so that if they develop the infection, they don't spread the infection any further. It's a way of stopping the chains of transmission. To do that on a large scale requires establishing protocols on exactly how you interview cases and how you talk to contacts. It involves putting in place software so you can manage a lot of information. It involves hiring people. It involves working with partner organizations that have come forward that want to work with us and assist with contact tracing. All of that are systems that we're putting in place now. They're not in place now, but we're putting them in place now. And as we make progress on that, I'll be reporting that here in the future. Overall, I can say we're clearly making progress against this in the epidemic. Still, however, there are too many cases that we're seeing every day for us to safely restart activities. Let me give you a little bit of a peek into the future, though. Some people may think that after we get past this particular wave of the epidemic, the virus will be gone. That's not the case. Success doesn't mean no virus. Unfortunately, the virus is going to be around until we have a vaccine that we can give broadly to people. What success looks like in the future is the virus is at such a low level we can resume most of our activities and most people are not going to get affected. So suppression of the virus is what we're shooting for here. We do think we can come up with a system where the virus is at low levels and we can restart most of our activities in a safe way. We'll be coming out with more information in the future about how we restart activities safely. But as I said before, it's going to involve several things. It's going to involve people wearing masks. It's going to involve people keeping their distance from people in public. It's going to involve people washing their hands. For more information about the epidemic, go to www.phila.gov/COVID. Or if you have medical questions, 1-800-722-7112. Thanks.
Thank you, Dr. Farley. And now Armando will provide the Spanish language translation of the mayor's and Dr. Farley's remarks.
Mensaje del alcalde Jim Kenney para el miércoles 13 de mayo del 2020. Buenas tardes a todos. Me gustaría comenzar recordándoles que mayo es el mes de concientización sobre la salud mental. En este difícil momento, es más importante que nunca buscar ayuda si usted o sus seres queridos tienen problemas de ansiedad, depresión, dolor u otro trastorno de salud mental. La semana pasada anunciamos una campaña conjunta de la ciudad e Independence Blue Cross para contar con recursos en salud mental más fácilmente accesibles para más habitantes de Filadelfia. Estos están disponibles en mindphltogether.com, es decir, mindphltogether.com. También quisiera mencionar los recursos disponibles para nuestros niños. La semana pasada, en el Día Nacional de la Concientización sobre la Salud Mental de los Niños, el Distrito Escolar de Filadelfia anunció una asociación con el Uplift Center for Grieving Children para ofrecer Philly Hope Line, una nueva iniciativa que para que los estudiantes y familias del distrito escolar puedan recibir servicios de salud mental. El Dr. Haidt y el distrito escolar reconocen que el costo mental y emocional que el cierre de las escuelas a raíz de esta pandemia pueda tener para nuestros estudiantes, familias, padres y representantes. Los estudiantes extrañan a sus amigos y a sus maestros. Los adultos mayores están decepcionados por perderse los eventos tradicionales como el baile y la ceremonia de graduación. Y los padres y representantes tienen un nuevo reto: enseñarles a sus niños desde casa mientras muchos de ellos también tienen que trabajar desde su hogar. Philly Hope Line, que se lanzó oficialmente hace 2 días, cuenta con personal clínico de Uplift y les ofrece servicios de asesoramiento a estudiantes, padres y tutores. Este programa está disponible llamando al 1-833-PHL-HOPE, que es el 1-833-745-4673, o enviando un mensaje de texto al mismo número. Este servicio les permitirá a los estudiantes y a sus familias hablar con los médicos por video y por teléfono. Si los estudiantes y sus familias llaman fuera del horario de atención, tendrán la opción de dejar un mensaje y recibirán un número de teléfono al cual llamar en caso de emergencia. Y todos los mensajes se contestarán al día siguiente. Los médicos de Philly Hope Line están disponibles de lunes a viernes de las 12 del mediodía a las 9 de la noche, y los feriados, sábados y domingos desde las 12 del mediodía hasta las 4 de la tarde. Una vez más, el número de teléfono es 1-833-745-4673. Les agradecemos al Distrito y al Uplift Center for Grieving Children por apoyar a los jóvenes y a sus familias en Filadelfia en estos tiempos de crisis. También aprovecho la oportunidad para compartir buenas noticias respecto al censo 2020. Philly Counts, la iniciativa de la ciudad para apoyar al censo 2020, ha alcanzado un gran hito en sus esfuerzos de divulgación. Todos los días, Philly Counts y sus voluntarios llaman a miles de hogares en Filadelfia para asegurarse que tengan lo necesario para mantenerse seguros y saludables durante esta pandemia y para concientizar a los ciudadanos sobre el censo y su importancia. Ayer, Philly Counts superó las 50,000 llamadas. Fueron un total de 52,375 llamadas que generaron 8,354 conversaciones significativas con residentes de Filadelfia. Durante estas conversaciones, Philly Counts y sus voluntarios les ayudan a las personas a crear un plan para completar el censo del 2020. Esta semana, el equipo también se está enfocando en difundir información sobre el programa de ayuda de emergencia para los inquilinos durante el COVID-19. Les recordamos que un censo completo y preciso ayudará a que la ciudad de Filadelfia pueda responder a emergencias como la pandemia del COVID-19. Los datos que recoge el censo son útiles para identificar las áreas de la ciudad con grandes poblaciones en riesgo. Y el gobierno federal también utiliza estos datos para asignar los fondos necesarios para reconstruir nuestras comunidades después de un desastre. Y hoy, más que nunca, Filadelfia necesita un conteo completo y preciso en el censo del 2020. Recuerda que si vives en Filadelfia, tú cuentas en Filadelfia. Los residentes pueden completar el censo del 2020 hasta el 31 de octubre de este año, haciéndolo en español, ya sea por teléfono o en línea, llamando al 844-330-2020 o en el sitio web, entrando a my2020census.gov, es decir, MY2020 Census, census.gov, G-O-V, y también rellenando un cuestionario de papel. Para poder importar hay que hacerse contar primero. Y esta es la actualización en materia de salud para el miércoles 13 de mayo del 2020. Desde ayer se han confirmado 242 nuevos casos del coronavirus en Filadelfia y actualmente tenemos un total de 18.779 casos en la ciudad. Hay una clara tendencia a la disminución de los casos y reportamos también avances en la evolución de los casos en los entornos grupales. Hay una disminución de los casos entre los hogares de ancianos y no reportamos casos nuevos en las cárceles. Actualmente solamente tenemos 7 casos confirmados. Hoy, tristemente, reportamos 78 muertes por la COVID-19 en la ciudad. Hay un total de 986 personas que han muerto por la COVID-19. Este número elevado de muertes se obtuvo al comparar los certificados de defunción con la base de datos del COVID-19. Esta es una comparación que se hace una vez por semana. Muchas de las personas murieron entre el 21 de abril y el 7 de mayo. 528 o el 54% de estas muertes han sido en hogares de ancianos. Les recordamos que este virus no discrimina por raza o por género. Y hay 741 personas que han sido hospitalizadas en Filadelfia y 1.421 personas que han sido hospitalizadas en la región sureste de Pensilvania. Estas cifras nos demuestran un claro descenso. Se ha añadido a nuestro sitio web un gráfico donde se muestra el número de admisiones a los hospitales y las pruebas siguen disponibles con cita previa. Para mayor información, como direcciones o números de teléfono de los centros de prueba, por favor revisar el sitio web fila.gov/COVID-19 bajo la pestaña FAQ. Todas las personas de cualquier edad y que presenten síntomas deben hacerse la prueba del COVID-19. Hay 40 centros de prueba en la ciudad de Filadelfia y 60 en nuestra región. Los datos nos muestran que vamos encaminados en dirección correcta, porque hemos visto un gran avance. A medida que los casos disminuyen, la importancia de las pruebas y el rastreo de contactos crece. Continuaremos expandiendo los centros de pruebas y vamos a establecer sistemas para el rastreo de contactos. Pronto les ofreceremos mayor información al respecto. Y aún hay muchos casos como para realizar actividades normales, pero podemos empezar a prepararnos para la reapertura. Debemos acostumbrarnos a usar máscaras al salir de nuestro hogar, a mantener la distancia social y a lavarnos las manos. Juntos podemos superar este gran reto. Gracias.
Thank you, Armando. And now we're going to move to the Q&A portion for members of the media. Please remember that we have limited time during the briefings, so only one representative from each media outlet is permitted to ask questions during the first round. So reporters should limit their questions to 3 or fewer, and we will do a second round if time permits. And if you're logged in, please use the raise your hand feature found under the participants list. We ask that you use video and audio when you ask your question, if you are able, obviously the audio. We will now unmute reporters one by one to ask questions, and we will start with Mitch Blocker of NBC.
Thank you. Dr. Farley, I have a couple of questions for you to start with. Clinics in Philadelphia have showed us a new, smaller testing swab, and I'm wondering, do you think that these swabs will help you get closer to the goal of testing at least 5,000 people a day in the city?
I'm not sure what swab you're talking about. Is this using a different test, or is it just a different swab?
It's a different swab. It's like a Q-tip. It goes, it's much shallower into the nostril. It doesn't cause coughing.
Right, so that there is most of the tests are done where you put the swab into what's called the nasopharynx. That's the back of the nose. There is a new technology where you can just put it in the front of the nose. It makes it a little easier for people to collect the sample. And some laboratories are taking those samples and able to do tests. that's one of the ways in which make it easier for testing to be done. I think there's many other things we need to do, though, to hit our ultimate target.
And I am curious, you talked a little bit about the contact tracing. You have job postings right now the Department of Health does for contact tracers. How many people do you want to hire, and what are the skills that you're looking for?
We're not sure exactly how many we're going to hire because it's unclear how much funding we're going to have and how much we'll have to rely on volunteer organizations. The primary skills we're looking for really are interpersonal skills. These are people who are going to have to interview folks, find out where they were, where they spent time, get information that may be somewhat private, and then follow up and talk to other people who've been exposed and deal with people's fears and concerns and give them appropriate information. So it's not so much a technical job as it is an important job that requires interpersonal skills.
Thank you, sir. And I have one question for the mayor. Mr. Mayor, there's been some critique that the city hasn't spent the money that was allocated for COVID-19 response. In particular, minority communities have said that they need more testing supplies and places to get tested. I'm curious, are there any plans to spend more of the money that you're allocated in minority communities?
Well, before Brian gives you the numbers, we are working with minority folks who are Black and brown folks who are interested in testing more in Black and brown communities, which have been hit harder. There's a process we're following now. I think an RFP went out last night to folks who are interested in doing that. And we have been working with the Black Doctors Consortium since we're aware of their presence with PPE, with help with being able to bill for the services for the test, and I think some nonprofit status help. As far as the money's concerned, I'll turn it over to Brian.
Yeah, so we expect all $85 million that City Council appropriated to be spent in this fiscal year. I think the budget director and the finance director have been pretty clear that the most recent report on spending did include some large expenditures, including some of the costs associated with the Leah Core Center, as well as some staff costs. So, we are, this is a very large operation, and we expect to need all that $85 million, and certainly recognize the disparate impact on our Black and brown communities, and are doing everything we can to reach those communities. That's exactly why Dr. Farley has expanded testing as broadly as he has, and continue to find other ways to reach out for testing.
Thank you.
Dr. Farley, did you have something to add on that, or are you good?
Yeah, just to point out that the limits on testing we've had are not limits on money. It's a limit on the supplies, how many swabs we can find, and it's a limit of how many laboratory tests can be run in a certain day. So that's what's prevented us. So those are gradually getting better. We have achieved a lot now to get more than 40 sites in the city of Philadelphia alone. We'll have more in the future, but it's not really a financial limit. It's the limit on just how many tests can be done.
All right. Thank you. Thank you, Mitch. We're going to go now to Shira Arias of Telemundo.
Hi, everyone. Good afternoon. Armando, la primera pregunta será, ¿cuál es el plan de Filadelfia para el rastreo de contactos y qué tan beneficiario será este sistema para poder reabrir la economía?
The first question is, what is Philadelphia's plan for the tracing contacts, and how efficient will this be in order to reopen the economy?
So I'd said before, but just to summarize, we do plan to be tracing contacts, interviewing cases, finding out who they were exposed to, and getting those people notified so that they go in quarantine. Our goal is to be able to do that when we get to 50 cases per day. With all of those cases, we'll start it before then. This is just one piece of a larger strategy to prevent the spread of the virus. We're going to need the other pieces like wearing masks and keeping distance in order to keep the virus at low levels.
Este es un plan que nosotros tenemos para hacer un rastreo de los casos en infección para la gente que ha estado expuesta y notificarles a las personas para que puedan empezar su cuarentena. Pero pensamos hacerlo a partir de los 50 casos que vamos a tener diariamente, y esto es solamente un componente de un programa más grande de la estrategia que tenemos, que también incluye el uso de las mascarillas y el mantener la distancia social.
¿Qué está haciendo la ciudad de forma diferente para poder evitar que ocurra un brote similar al que se vio en el área de Center City, en el hogar donde están las personas desplazadas, donde vivían solamente hombres? Entonces salió una persona positiva, salieron otras personas positivas que eran asintomáticas. Entonces la comunidad en Kensington siente que es cuestión de tiempo de que esto suceda en Kensington, en cualquier otro albergue de esa misma forma en el área, y entonces, ¿qué está haciendo la ciudad para poder evitar de que esto suceda? ¿Están aumentando las pruebas? ¿Qué están haciendo ellos diferente para que esto no suceda allí?
What is the city doing differently in order to prevent another outbreak in Center City, such as took place in the homeless men's shelter, where there was one person and then several others that were asymptomatic? Because some people think that it's a matter of time before another outbreak happens at a shelter. What is the city doing different in order to prevent this?
I'm going to say homeless shelters, like nursing homes, are settings where many people live together, and there's definitely a risk of transmission. So we are working with the Homeless Services Department on what we can do to protect those shelters that have not had a case in them yet, including seeing if we can take those people who are particularly vulnerable and moving them out so that if there is an outbreak there, those people are not infected, to see what testing might be appropriate, and to see what kind of physical barriers we can put in place to protect the people who are living in these close settings.
Bueno, nosotros estamos tratando a los albergues de la misma manera como hacemos con los hogares de ancianos, donde se congregan mucha gente junta, hay el riesgo de la transmisión, y estamos trabajando con el Departamento de Salud para retirar a las poblaciones y a las personas más vulnerables de esos entornos, y estamos viendo cómo avanzar con más pruebas para poder intervenir de esta manera.
Y por último, last, ¿cuántos casos positivos exactamente fueron que surgieron en aquel caso de Center City? Y si ellos tienen números de casos positivos de personas desplazadas en Kensington, y en dado caso, ¿cómo ellos están contactando con esas personas que son desplazadas y no tienen un celular para que lo llamen y le digan, saliste positivo?
I would like to know exactly how many cases were diagnosed in the case in Center City, and also the number of cases that were diagnosed amongst the homeless in Kensington, and how are folks being contacted, especially those that are homeless and have no cell phone, to be told that they've been exposed?
I don't have those numbers for you. We'll get the numbers that we can have access to back to you. And certainly if we do testing in a homeless shelter, there'll be people that will go in there and provide that information directly with the results to those persons, because they're not going to be calling for the results.
No cuento con esas cifras en estos momentos, pero cuando las tengamos te las proporcionaré. Y cuando se hacen las pruebas, especialmente para los desamparados en los refugios, se les da los resultados en ese momento, porque obviamente no hay otra manera de comunicarse con ellos después.
Thank you.
Okay, thank you. And next up is Max Marin of Billy Penn.
I'm good, Mike. My question got answered. Thanks.
Very good. Natasha Brown of CBS 3, you're up.
Hi, just wanted to ask Dr. Farley this question. If you could just tell us the latest information on the inflammatory syndrome in children that possibly is related to COVID-19 in Philadelphia, how it relates here, are the numbers increasing, and are you concerned at this point?
Yeah, I don't have updated numbers for you today. We can look and see if we have any updated numbers. I believe that there has been now a case definition written down, so we can clearly know how to count cases, so we have a more precise number than we've had in the past. I'll see if there's any more update. I don't have one today. I can tell you that we are concerned about it. It doesn't appear that this is a common complication. This is a complication which clearly can be serious.
And it is linked to COVID-19? Has that been confirmed?
I think most people feel that it is. I think that more studies actually prove that, but I would certainly say it's likely.
Okay. Thank you very much. That's all I have.
Thank you, Natasha. Next, Jack Tomzik of Metro.
This question is for Dr. Farley. With the contact tracing, is the city just, getting started on this? And if not, what has been done so far?
Well, when the epidemic first hit, we were interviewing all cases and getting to their contacts. But when we got to hundreds of cases per day, we weren't able to do that. So currently, what we're doing is focusing on people who are in congregate settings, and we do contact tracing on those folks. That's where the contacts are most likely to get infected, and that's where the contacts also are more frequently have underlying health conditions, and so they're more serious if they have the infection. Now we're trying to build up, and how do we do contact tracing for the rest of the people, the ones that are not in congregate settings? That's a very large number. We're not going to be able to do all of them anytime soon, but we're trying to put in place a large system so that as the number of case counts come down, we can do all of them.
And you mentioned the congregate care setting. So does that include nursing homes? Is the city helping to do contact tracing in nursing homes?
Absolutely. Yes, we're working with nursing homes when they have a case on how they address the risk to those that are exposed. That includes homeless shelters and other congregate settings.
All right. Those are my questions. Thank you.
Thank you, Jack. Now we go to Martin Pratt of YBN Philly.
Yes, thank you. This question comes from some readers who are churchgoers, and they were curious as to, I guess, Brian or Dr. Farley, for churches that have large spaces, is it possible for them to meet in those large spaces and do social distancing? And if not, what suggestions do you have for congregations that are looking to get together, not to do on virtual, but to actually have some type of get together?
Right now, I would say it's still too risky, and I would definitely discourage congregations from getting together. As we approach trying to take our first stage towards reopening, we hope to have recommendations for a variety of organizations, including churches, and how they can do that safely. We don't have this in writing yet, but we hope to have that with enough specificity that people will have a real sense of what they need to do and what they don't need to do.
Excellent. And Dr. Farley, kind of following up to Mitch's question about the money that's needed to help testing. You said that it's not a money issue, it's a testing supplies, but obviously if you don't have the money, you can't buy the supplies, right? So can you make that line a little clearer, how it's not money, but it's supplies?
We could have all the money in the world, and I can't buy enough of the swabs, as many swabs as I want to buy. They're just simply not available. We've ordered them in the past and are still waiting for them. That's what I'm talking about.
Excellent. Thank you. And lastly, can you speak to Memorial Day? I'm very concerned, and a bunch of friends of mine are also concerned about spikes happening because of Memorial Day. What's why is it important for us as a city to really drill down on Memorial Day and to do social distancing?
Yeah, Memorial Day is an important time when families get together and they have picnics and do a lot of things which are really important to, holding together our society. Unfortunately, the mathematics of this work, that the larger crowd you have together, the greater the risk that one person can affect many other people. So it's really important during that time that people not be in proximity to each other, not be close by so they can't spread the infection. We'll have more specific advice as we get closer to that, as we've given advice just before Easter, but it's not too early to start saying that now. We're not going to be in a position at that point to say great people can get together in crowds on Memorial Day. The virus will still be here. There'll still be plenty of cases. People are going to have to keep their distance from each other and avoid the crowds.
Thank you.
All right. Thank you, Martin. We're going to go now to Laura McChrystal of the Inquirer.
Hi. First, I'm wondering if you could give a sort of a general update on your efforts to obtain PPE. Has it still been difficult to find places to order them from? Do you think you've obtained enough at this point? Anything along those lines?
So no, we don't think we've obtained enough and continue to struggle to source N95 masks. We're continuing to work with the American manufacturers and PEMA and FEMA to provide to see if we can't better source that. We're also having significant issues around isolation gowns, which we are looking at alternatives and trying to provide them to our healthcare systems. But those issues are still alive and well, and things that folks work on every day.
Okay. And I know last week, this question is also for Brian. You had mentioned that, or maybe for the mayor, but I think you both had mentioned last week that layoffs were beginning and that employees were being notified that they would be laid off as of June 1st. Have all of those people in that kind of first group, I guess, been notified, and how many were there?
Right.
I am not certain that they've all been notified, but they should all be notified this week. And I don't have a final number. We can see if we can't get that to you.
Okay. And lastly, a question for Brian. You talked last week about the situation at the airport with people sheltering there and said the city would be looking for a solution since that couldn't stay at the status quo. Any updates?
We're optimistic that we'll be able to resolve those issues by the end of the month. I think we are actively working on a couple of things. One is to make sure that our most vulnerable residents that are currently in congregate care settings are moved into more appropriate settings. And by doing so, we think we'll also open up shelter space that can be made available to those people who are sheltering in the airport. So I think there's a few moving pieces, but we're working very well with SEPTA and the airport in order to address those issues. So reasonably optimistic that we'll have a resolution at the end of the month.
Thank you.
Yep.
Thank you, Laura. This is the last call for questions, folks. We'll go to Pat Loeb of KYW.
Thanks. The city commissioners today approved or sent to the state a plan for election day that includes in-person voting, a drastically reduced number of polling places. But I'm wondering if Dr. Farley is working with them on a plan for how to keep poll workers and voters safe and socially distanced.
Not me personally, but the health department is working with the city commissioners on a plan to make it safe for people who vote at the polls. But I did say the other day, and I want to just reiterate, the safest thing for people to do is to vote by mail. And so people should go ahead and apply now so they can get a ballot and vote by mail. The polls are available for people who don't want to do that, and don't feel they need to do that. But the polls will be as safe as possible, but voting by mail is what we want to encourage.
And this is one of the issues that will change in our lifetime and going forward, how people do vote. And I expect that because of this pandemic and being pushed into the situation, we're going to wind up voting by mail, as the majority of voters will vote by mail at some point in time in the near future. And I think that's safer and better and actually safer when it comes to election results.
Hey, thank you.
Thank you, Pat. Let's go to a second round and back to Martin Pratt of YBN Philly.
Can you hear me?
Yep, go ahead.
Thank you. Dr. Farley, can you explain a little bit more in detail about how are the cases that we get per day, how that relates to what the governor has set as to when it's safe to open? I've tried to explain as best I could, and I think that I'm even getting it incorrect. So if we get to less than 50 infections per day, then we can open the city.
There are two numbers that are very similar. It's easy to get confused. The governor's number is over a 14-day period if you have less than 50 cases per 100,000 population. That's cumulatively over 14 days. If you work out the numbers, that ends up being about 55 cases per day in the city of Philadelphia. Okay, that's the target that the governor has laid out.
And it seems to be a point of contention with some counties. I know the mayor spoke to this earlier in this week. Is that what the Department of Health from the state and also our local Department of Health you agree with? Or is there, as we see numbers drop, we get close to 75. We get close to, I've had a question of somebody saying, what if we get to 50, 59, or is it?
I think the governor's been clear that that's not just one magic number. As soon as you hit the threshold, then that's it. That he's looking at other indicators as well. We're also looking at other indicators. We want to be able to feel that we have, for example, the situation in the nursing homes under better control. We want to be able to say that we're at least starting our process for contact tracing. We want to have other things that indicate that if we start some activity and the virus starts to pick up speed, we can identify it quickly and act on it quickly. So that is an important number. It is not the only number that either the governor's looking at or that we're looking at.
But the other issue, too, is consumer confidence. Even if we get to the point of opening in the Southeast region, people still have to feel comfortable enough and safe enough to go out to a restaurant, go out to a retail outlet. And that'll be a learning curve also. People will have to feel safe going out and doing the things they used to do in a different way.
If I can also add that it's not like we're just going to flip a switch and we're closed now and we'll be open in the future. Activities will restart in a very careful, stepwise way. We'll start with the activities that we think are the lowest risk and work our way towards the highest risk one. And if we see a virus activity that starts to pick up, then we can backpedal from there. So it's not going to be one thing at all. It's going to be a very staged process.
Excellent. Thank you, Mayor. And thank you, Dr. Farley. One last question. The ability that we have currently to track what's happening, will that stay in place past the reopening? Because I'm reading about Seoul and I'm reading about Lebanon that now are back in lockdown because they've noticed these sharp increases and they want to taper that before it gets to a curve.
We will have all of the data systems we have in place now, we will have in the future, and we may have some more data systems as well, so that we can have hopefully an early warning sign that the virus activities starting up. Now, as this plays out over months, I would assume sooner or later we're going to have some flare-ups, and we're going to have to backpedal at least to some degree with flare-ups. So I don't consider what happened in Seoul a bad thing. I think that they opened things up in a responsible way. They found at one point, okay, wait a minute, we opened up this part too much. They backpedal. That's still overall a success. Most of their society is functioning, their economy is doing well, and the virus is at low levels. As much as that's a bit of a problem, that is unfortunately what success looks like until we have a vaccine.
Got it. Thank you.
Thank you, Martin. And let's go now again to Laura McChrystal of the Inquirer.
Hi. For Dr. Farley, the testing numbers per day, I know that's posted on the website, the test results per day, but I know that there's a delay there. They can take days to come in. So I'm just wondering if you have any sense of how many more, as a result of increasing testing over the past week or two, how many more tests per day are happening?
We are somewhere around 1,300, 1,500 tests per day. Last week, I think we were over 1,500 tests per day. We'll find out where we are over time here. It's not going to be a steady increase. Unfortunately, every time we expand, we bump into problems again. For example, some of the laboratories are now saying they're short of swabs again. But anyway, we're somewhere between 1,300, 1,500 per day now.
Okay, thank you.
Laura, did you have anything else?
That's it.
Okay, great. And that is it. That concludes today's daily briefing. Thanks for joining.